Recording, Brian. Okay. Okay, well, good morning. Today we have Tammy from Gracefully at Home Caregiving. She has a $1 million smile and a $1 million personality, and she is very caring and loving, and that shines through in her conversation and the way that she talks to people. So we're going to get some information about her. So tell us specifically, Tammy, how you help seniors. What is the way that you handle the situations that you come
Sure.
across?
Sure. First of all, good morning, Joelle and Brian. Thank you for having me. So the way that I help seniors, first of all, my background is a registered nurse of over 20 years. And my background of helping seniors is we come into the homes of those seniors who want to stay in their homes as opposed to going to an assisted living or nursing home. They want to stay in the place that they've built, the home that they've built, right? So we come in and give them what we call assisted living services. So maybe they're not having a little trouble with some dressing or preparing meals, things that may get in the way from them living the best functional life that they can. So we come in and we help them with those little activities of daily living so that they can live a more full life enhanced life at home.
That's wonderful. And tell us how you got into this industry. I know you're a registered nurse, you've been doing that for a while. What encouraged you to start this business?
Well, it was my own parents, right, who were aging. And it came smack in the middle of the pandemic, if you can imagine, in the middle of 2020, when both of my parents were at the place where they needed a little bit of assistance. And we know with the pandemic came all this isolation. They couldn't go anywhere. People couldn't come in to visit them. So we found ourselves in a position where we needed to get some assistance for them. My siblings and I were all what we call the sandwich generation, right? So that's the generation where you are, in essence, stuck in the middle. You have your own family to deal with. You have your own career or profession that you're working on yourself. And then you have these aging parents or parents-in-laws, right? So we found ourselves stuck in the middle. And we knew we needed to get our parents some support at home. We tried the traditional ways of going with agencies, and we weren't as happy because when you have a higher level of standard of care, you expect that. So when that wasn't working out and we went through a few agencies and even a few independent providers, we knew there had to be a better way. So this prompted me, and because of my background and us knowing exactly how we wanted our parents to be treated, we figured how many other families are out there like us who are not getting the treatment that they would ask for their parents. So in 2020, Gracefully at Home was born.
You know, Tammy, having met you, and that's why Joelle and I really wanted to share you with our audience. What you do is a little different than just in-home care.
Exactly.
There are tons of agencies, I mean, tons that do in-home care. But you have a little bit of a different take and a little bit of a different methodology. Share that with us, if you will.
Sure. Thank you for asking that, Brian. So we like to say that we are chronic illness support at home because most of our elderly, with age comes some chronic illnesses. And what we find most of the time is that they're not being properly managed at home. That's when they find themselves on this cycle of going back into the emergency room, back into the hospital, back home. It's a vicious cycle. So we focus on the person holistically, right? We believe that you need to be able to care for somebody, mind, body, soul. So we focus on the emotional aspect as well as the physical aspects, right? The hydration part, the mobility part, right? And then we focus on medications, right? Because what we find is a lot of our clients are not taking their medications as they should be. So we come in as a team, we create a whole plan, a whole holistic plan for these clients, right? So we make sure they stay hydrated. We make sure they're keeping up with their appointments. We care for the whole body. We're not just bodies in a space just to watch them, but we get them involved in the care, and we find that we have much better results.
It's interesting because I moved here with my parents. We purchased a house together so that I could do what your company does. And I can say it's a lot of work. I'm always like getting their medications together and saying to my mom, you can't take your medicines at 2 o'clock, your morning medications. You need to take them in the morning. Like, they're not working
Exactly.
effectively if you're not taking them in the morning. And having things that to keep my father from slipping and falling, like socks that have grippers on them, just constantly trying to find ways to make life easier and safer for them. And it is a real challenge, I'm going to say. So,
It is.
kudos to you. And there are a lot of people, as we know, here in Florida that do not have relatives that are either close by or have the ability to be there for their parents to do what you're doing. So the service you're providing is really essential and very, very much needed.
What struck me, Tammy, was your intake process, let's call it. Okay. Because what often happens, I mean, we had hospice care for my dad, and my mom was an unreasonable person. I loved her dearly, but she was unreasonable and she sent the nurses away, which was just terrible. But that dynamic probably happens a lot of times. And what I find is that most home care agencies, if you will, they send someone and pray for the best, right? Maybe you have to send someone else. My mother-in-law just passed away in January, and she was very sick. She had in-home care. The ladies were lovely that came to take care of her. She went through 5 of them, and then the agency said, "We just can't. We're done. We can't help." She
Right.
didn't want anybody. So that it really was that basic. So you have a little bit of a different intake process. Tell us about it.
Yeah. So we tell our clients that you get to choose the caregiver of your liking, right? And this really sets us apart from any other place. After I meet the client first to find out what their needs are, what their hobbies are, what they like to do. And then
They
I
got to fall in love with you right away, Tammy. Everybody does.
Well, thank you for that, Brian. Once I find a suitable caregiver, or I look through my list and find a suitable caregiver, I bring that caregiver for a meet and greet. So one of our promises to our clients is you'll never be cared for by somebody you haven't met and like and want to be on your case, right? So I bring those caregivers in to meet the client. The client gets to interview that caregiver. The caregiver also gets to interview that client. So they both get to decide, is this a good match for me? Because the last thing you want is a client that's unhappy with the caregiver, right? And then the last thing you want is for a caregiver to be unhappy in the space that they're working in, because they're not gonna perform to the optimal level. They're not going to be of any service to that client. So we find that this process, by carefully matching them, giving them an opportunity to meet each other, ask all those pertinent questions, see what the personality is, works best. Those clients agree to those caregivers, and the caregivers likely agree to the client, and then we create long-lasting relationships.
It's so different, so wonderful. I mean, I guess the word is wonderful.
What
Because
I'm sorry, go ahead, Brian.
no, go ahead,
I was
Joel.
just going to say what I really love about that is a lot of times when you're aging and you're declining in some way, we never want to admit that we're declining, right?
Right.
And then when you agree to get the help, it's really wonderful that they are part of the process, because many times it's just an adult child who will say, "I'm bringing in home health care. The lady or the gentleman will be there tomorrow at 9 a.m."
Right.
And that's it. They have no agency in who's coming, when they're coming, picking the person. So this really gives them the opportunity to, buy in because they're part of the process, which I
Exactly.
think
Making
is
them part of the
extremely important.
process.
Yes, because otherwise you're just, in fairness, the adult children are doing what they think is best for their parent, of course.
Mhm.
But I think sometimes we miss that piece of including the parent so that we get their buy-in. So
Right.
I just love the way that you're doing it. And I would imagine your success rate of the pairing is much higher. So you don't have that another person, this cycling of different people in their homes, because that's also unsettling.
It is. And can you just imagine being the elderly person who's slowing down mentally, physically, you still want to have some say-so while you can in your care.
Of course.
And this gives the clients that opportunity. They're happier, they participate more. Oftentimes we see their level of care go down because they're better. So we can come to them less often, which in turn saves the family money because they love their caregivers and they're willing to do more with that caregiver when they suggest it. So it's a win-win on all sides.
Does
Fantastic.
caregiver take them to a doctor appointment or shopping or to lunch, or, you know, if they want to go out, or does it have to just be in the home where they're attended to, or does it become more assistance just generally?
So it's a general assistance. Whatever that client wants to do, as long as it's legal, right? and safe for them, of course.
That's no
Whatever
fun,
they
Tammy.
want to do, we provide them that assistance in doing it, whether it be grocery shopping. Many of our clients still like to be social and go to bingo and go to lunch, right? And go to their social clubs. But maybe because they don't drive anymore, they just need somebody to tag along with them. We do that. Hairdresser appointments, you name it, anything that they need, we're there to help them in that aspect so
And
that
it
they
has to
can
be
keep
legal.
living the fullest life they can.
It has to be legal.
It has to be legal, Brian.
Oh, okay. Oh, okay.
Now, is it covered by insurance or is this out of pocket or a combo?
Okay, so our services are basically private pay.
Okay.
For many clients who have long-term care insurance, that's where the long-term care insurance will come in. The client has to be in need of, I think, 3 of the activities of daily living. So they may need help bathing, preparing meals, or mobility. That's when the long-term care insurance will kick in. Long-term care insurance will reimburse the client for what they paid to the agency if they have a policy with long-term care.
I see. So just out of curiosity, of those 3, I know you mentioned mobility. Does that mean fall risk or does it mean they need assistance walking?
It means they're unsteady on their feet and should not be able to walk by themselves without anybody their assistance or just providing those safety precautions.
I see. Okay, that's interesting. I was asking that question because my daughter has a friend that tangentially is in this area. She's an audiologist. And she was saying that if people have a fall risk, then somebody can get paid to take care of them. So I was just curious what if that fell into that category. I don't know if it's real or not. It's just a suggestion.
Yeah.
Is there we always love to hear a success story. Do you have a success story that you'd like to share with us?
I do. So we have a client currently, actually, that when we came on board, had some type of dementia and was very aggressive toward others. Wasn't pairing well with any of the caregivers that were sent in. Needed to live in an assisted living facility because no longer able to take care of themselves. We came in, we formed this relationship with this client, bringing in one caregiver at a time to get them acquainted with that person, to get them to what we all say in business, know, like, and trust that person, right? Because once these clients know, like, and trust you, you can get them to aid in their own better health, right? So we've been with this client for about 2 years now. All other agencies and caregivers could not do it. We've been the most longstanding caregivers with this person, and we have seen remarkable advancements. Just having us there to be able to participate with them in their daily activities of living has made a world of difference. So that's one of the success stories that we have.
That's an amazing story. And I'm glad that you brought up the assisted living. So you can go into assisted living, memory care.
Wherever the client calls home, right? So
Okay.
if they're already in assisted living, nursing home, memory care, we go to them wherever they call home.
Wonderful. That's fantastic. Brian, do you have anything else you'd like to ask?
Yeah, what are those criteria? So I know one of them is showering, right? Or being able to bathe yourself. One
Or
of them.
cooking would be an activity of daily living as well, yes.
Yes. When you set the criteria, are you talking about for long-term care to pay or
Yes.
just in general for us to come in?
Well, let's start with long-term care to pay.
Right. So those would be, like you said, the cooking, the showering, the dressing, the mobility, those type of areas where they can't really perform that function on their own and they need assistance. That's when the long-term care would come in. For us to come in, because we're mainly private, we're private pay, all that needs to is agreement for us to come in, right? Sometimes our clients only want socialization, but they can prepare their meals and, you know, they could take a walk by themselves and they just are missing that companionship aspect of life. So we come in and we provide that. So all we just need is for you to say, agree that you need the help or that you want the help to come in, and we come in.
What areas are you servicing?
Right now we service Palm Beach County to Indian River County, and Broward County will be added on shortly.
Super. And how they reach you?
They can reach us at phone number is 561-218-4703. You can also reach us on our website, which is www.gracefullyAtHome.com.
Fantastic. Okay, is there anything that we missed, Tammy, that you'd like to tell us about? We want to make sure you get your opportunity to say whatever it is you want to let everybody know out there.
No, I just thank you for the opportunity. Just know that we're here, we're in the community. We can usually start the same day that you call us in, if not sooner. And that we're here to provide holistic care to the clients so that they can live a happier, safer life.
Super.
Thank you, Tammy. This has been amazing. You're truly like a light in the community. And I really appreciate all that you do. And I'm sure your clients do as well.
Thank you for giving me this platform. I really appreciate it.
Okay.
Of course.
Thank you.